As we've learned over the past few weeks, the coronavirus pandemic, unfortunately, has not gone anywhere.
It's time to check in with Dr. Zorba Paster, who's also taking your questions at 270-9933. Zorba, welcome back.
Hi, Zorba. Good to see you.
What are we seeing right now?
Well, what we're seeing is, of course, a spike in the number of cases. But according to the CDC, it may be that there actually are more cases than we're seeing. And if you do an epidemiological analysis, in other words, it's not just that everyone who has COVID actually gets a positive test. Most people don't even know they have COVID. Instead of 125,000 deaths, we think the number of deaths may actually be higher because at the beginning of the pandemic, a lot of people who died of pneumonia actually had COVID, and we didn't really know that it was actually COVID at the time. So instead of maybe 125, there may actually be 150 or 175,000 deaths because we really were not taking that into consideration. In fact, initially, it wasn't even something you could sign off on the death certificate. So the number of deaths is not lower, the number of deaths is higher. And then if we look at the number of people infected, we think the number of people is somewhere near 5 or 10 times as many as picked up. So we're really in the midst of the pandemic right now. It may go higher. That's what we think in the wintertime, but it certainly is much more than we ever thought.
Well, how concerned are you that we seem to be going in the wrong direction?
Well, I'm very concerned, just like everyone else. And I'm concerned because of testing. So what's really interesting is an epidemiologist came out with a very interesting model of how to increase testing. So let me explain it a bit. You batch them. And what you do is you take 10 people who have tests. Okay, there's liquid. You take a swab, you put it in liquid. You test all 10 one time. Okay, so 10 are in a batch. If they're all negative, you now know everyone in that is negative. And all you did was one chemical test. If it's positive, then what you have to do is go back into each one of those individual 10 tests and find out which 1 or 2 people were positive. If we took that approach of batch testing, we could increase the amount of testing dramatically and make it even easier to find the people who have COVID and say, look, you have COVID, you're home for 14 days. And that's the real way that we'll get a handle on this epidemic. And I think that may be forthcoming. Batch testing of the negatives, if one of those 10 is, if it's positive, then you retest all of those, and it would be a very efficient model.
270-9933. Officials in Dane County just today have limited closing the bars, essentially. Do you think that's a source of a lot of the current cases here in Dane County?
Oh, I think that's probably part of it. And, the issue is you just have to go out. When I went out a week ago and I ended up grocery shopping, I saw more people in mass a week ago than I see now. And I think to myself, really, why aren't you wearing a mask? It certainly should not be a political issue. I mean, basically, is washing your hands after you're in the washroom a political issue? No, it's a polite issue. And the reality is I think a lot of people are not wearing masks, not for politics, but because they're lazy. And they go, I don't have to wear a mask. It's really not as bad as people thought. And let me tell you, it's worse than we think. It's not less than we think.
Yeah, wear a mask. It's not a political statement. All right, let's go to the
social distance, because social distancing is really the key thing. The mask is secondary.
All right, let's go to Evelyn in Madison. Hi, Evelyn. What's your question?
I just have a question about, can I contact our coronavirus?
Go ahead.
Hi. I have a question. If I had a confrontation with a parent where neither of us were wearing a mask, would either one of us able to contact?
Well, if
you mean contract the virus?
Right.
If you were near somebody who had coronavirus, then it certainly is possible that you could have contracted coronavirus. But if you were simply with somebody who didn't have coronavirus, the risk is there. You really don't know about it. And of course, sometimes we come into closer contact with people. So you can't answer that in a very specific way.
Yes, some people have it and are asymptomatic.
Exactly.
Let's go to Debbie in Middleton. Hi, Debbie. What's your question? Debbie, are you there?
Listen.
Debbie, can you hear me?
Debbie, turn your TV down.
Let's go to Debbie in Middleton. Hi, Debbie. What's your question? Debbie, are you there? Listen.
Hello?
Hi,
Debbie. Go ahead.
Can you hear us? Go ahead.
Yes, I wanted to know if you always have a fever when you have the coronavirus?
The answer is no. You don't have a fever at all. In fact, it's thought that at least 50% of the people, if not more, have no symptoms at all. They're just carriers. The virus comes in, the terrorist virus comes in, attacks you. It's just silent. As far as we know, you don't have any symptoms at all, and you pass it on to other people. Now, whether or not you will have complications 5, 10, 15, or 20 years down the road, that's the big question. We know that some viruses actually affect you adversely 20 years later. But yeah, you can have no fever, no symptoms, no sore throat, nothing.
So taking the temperature before you enter a business, is that useless?
Oh, it's a great idea because if you have a temperature, first of all, you're more likely to be sick with anything because you've got a temperature. And if you've got a temperature, the risk of your having coronavirus is higher. Why? Because you've got a temperature. So it doesn't eliminate everyone without a temperature who has coronavirus, but it makes it more likely. People with fevers are more likely to have coronavirus than people without fevers, simply because those people are fighting the disease and may not know it. Once again, you may walk in and hey, they do a forehead thermometer and hey, they've got a fever. Well, they might have coronavirus. And everyone with the fever who goes in a room ought to get tested because once again, it's higher risk, more likely that you might have it, even though that risk is still small.
And what's the level of the looking for the temperature? 100.4 or?
Around 100.4, 100.5. That's the level they're looking at. But frankly, any institution that does it will set their own levels. So they might set, like in our office, the level might be anything over 98.6. In a restaurant, it might be a level of 100. But again, it's not that the temperature predicts that you have COVID. It's that the temperature makes it more likely that you actually have an infection such as COVID, and that's why they want to eliminate you from the restaurant. Because look at the two restaurants in Madison, the Grays, I believe, and the Great Dane. They ended up having having servers in there who had coronavirus. Obviously, they didn't have any symptoms, and now they have to suffer the consequences, figure out how to sanitize the whole thing, and so on.
Well, based on what you were just saying about how you can be positive and not have any symptoms and not know you're infecting other people, would you recommend everyone, whether you have symptoms or not, get tested?
If we could do that, the answer would be yes. We ought to get tested, and we should be tested on a regular basis if that were possible. It's not possible. We do not have the apparatus. We don't have the ability, and if we batch tested and then had more people who were able to do that, we could be tested on a regular basis, and we could actually do it nationally and wipe it out. But the infrastructure is not there. The materials are not there. And frankly, the willingness of the public on a federal level or a state level is not there. And so this thing is going to continue, and that's why we are, I believe, the #1 country in the world with coronavirus right now. Not something we should be proud of at all.
We didn't lock it down long enough? Is that one of the issues?
We didn't do it early enough. We didn't lock it down long enough, and we still aren't taking it seriously enough. But you can see individuals are. People are lining up left and right to get tested. So a lot of individuals are taking it serious enough. We just don't have a methodology because we haven't come together yet as a society to put it forth. And frankly, the virus really doesn't care what we do, as a group or politically. It's going to continue to infect people and continue to kill people. And more will be killed in the wintertime than now because we're going to come inside and spread it to one another because we'll be even closer. And that's the part that, of course, I think we're all afraid of.
Yeah, and we should be. All right, Zorba, thank you. Stay safe. We're out of time. Thanks for everyone who called in. We have a lot of calls waiting, but
sorry about that.
We'll get to them next time.
Yeah.
All right.
Zorba, great to see you. Thanks for your time today.